What I'm going to show you in this video is how to use the alignment option, which is right here. Most of the time, our scanner are not able to orient and do a good alignment. So that's why we have this option. ExoCAD give us this option called an align mesh, where we will be able into ExoCAD to align and change the orientation of any kind of mesh to their proper position. So as you can see in this case, what I have to do is just change the orientation of this upper model, okay, related to our lower model. So in this case, what I gotta do is import, first, I gotta import an articulator, all right? So you gotta take these two models of your case, upper and lower, scan an articulator, and then save the STL file into the patient folder. Once you do that, you go to add remove mesh, which is an option that I just explained you in the previous video. And what we want to choose is generic visualization. So this new ExoCAD version gives you another option called Byte Align Mesh Scan. But honestly, I don't like it, and I feel more comfortable to choose generic visualization. I have more freedom. So generic visualization, load, and what I gotta go, it's right here on my patient folder. In this case, it's fertile jaw, and choose articulator or the file that you call the articulator. I just load it, and as you can see, I have my articulator, my upper and lower in the right position. But is not related to my lower jaw. So what I gotta do, first, better to change the color of this articulator, and then I click OK. So right now we have four different colors, and we cannot mix them up. So I go to Tool, Align Mesh, then first point on the mesh that I want to change the position. So in this case, my articulator, so first point here, and as you can see, I choose this spot, right? So on the second point is gonna be on this mesh, right? In the same point, okay? Because I want to move this articulator exactly over this lower jaw. So right here, and then another point here. So I'm gonna choose the second point here, and then third point here. So third one right here, okay? So you gotta choose points in the same spots in both of the meshes. Once you do that, best perform alignment, and the mesh, our articulator jump over our lower jaw. So it's close enough, but it's not perfect. If we want to make it perfect, just best fit meshing, and we will have just a perfect alignment with our lower jaw. So it's gonna just take a few seconds. And how we can see if our alignment is just fine. We have here a color line, right, from blue to red, and this is the part which are really interested, which is blues, okay? So it means our alignment is just fine. So once we are here, we just make clear. We just close this window. We want to open it again. And right now, what we want to do is we want to move this upper jaw over this upper jaw, which is our articulator. So again, first point on the mesh that we want to move, in this case upper jaw. So I'm going to select this tooth, which is my incisal. So of course, I'm going to choose this incisal on the articulator. And I'm going to do the same operation for 2-3 points. You don't have to be really perfect to select the 2 points, but you have to be a little bit close, all right? So once you select your point, just perform alignment, and again, our upper jaw jump and oriented in the same direction like our articulator, and then we can click best fit matching. As long as we have 2 same models, right? The model are the same, the 2 meshes, they come from the same models, the alignment should be just fine with no any issue. And as you can see, boom, clear, and this is our articulator right now. So it's pretty easy, and this is one way to do the alignment. I want to show you a second way to do an alignment. So as you can see right now, I want to put this C2, our situation mover, over this gingiva. But as you can see, these 2 models are not the same, are completely different. So the alignment, it can be perfect at 100%, but we can really be close using an option, which is this one, matching exclude selected part. So again, first, we want to select spots that they are the same in both meshes. So the first point is going to be on the upper, because we want to move the upper, my C2. So the first point is going to be here, second here, third point, it can be right here. I'm going to use these roots, right, the palatal roots. 2, I have one here, another one here, another one here, and I think is enough. So I select exactly 5 points, best fit matching, and right now our C2 is over our gingiva, but it's not really in the perfect position. So what we want to do, we want to concentrate in the area that we just select with the points. So if I click this option right here, and I increase the radius, and I click mark automatic. As you can see now, our ExoCAD is gonna make an alignment just on this area, right? So you can increase the area or you can decrease the area, right? It's the radius that we select around every point we selected. So I'm gonna do like around 7.79, something like that. And then best fit matching. So as you can see now, if I close this window, our upper jaw, it's almost there, okay? We have some color which they are mixed. And by the way, that's another thing that I want to tell you. Once you see the two color mixes together, means that the alignment is just fine, okay? As you can see right here, all of the model are mixed completely, so the match is good. Here a little bit less, again, it comes from two different models, so you cannot expect a 100% alignment, but we are really close enough.